So next, we are going to converse with Rhode Island Bio's life sciences advisors, who provided an extended network for the organization's board of directors and members in the arena of life sciences. But first, we're going to pass it over to Carol Malice, who leads Rhode Island Bio.
So welcome everybody. This is a wonderful opportunity to meet our new life science advisors. And as you all probably know, Rhode Island Bio is Rhode Island's life sciences trade organization. And we are the state affiliate for the Biotechnology Innovation Organization, or BIO as it's known, which is the world's largest biotech trade organization. And as a member organization, we advocate for our members and we provide advisory services, training, information sharing, webinars like the one that we're having today. And really, our mission is to grow the life sciences economy in Rhode Island. We are all about working with our partners and building our ecosystem and providing more capital, more resources, more entrepreneurial benefits and incentives to help Rhode Island really grow the entrepreneurial ecosystem. We strategically, we not only work with entrepreneurs, we work with incumbent workers and help them with leadership training so that they can advance in their companies and build a bigger and broader network of bio companies in the state. We also have a Women in Science initiative, which we're about to launch to develop more women leaders in Rhode Island and beyond. And we are looking at developing career opportunities for high school students in STEM fields, as well as internships for high school and college students. So we have a lot of exciting initiatives. We are almost 2 years now as Rhode Island Bio, and we are looking for a very bright future ahead as we grow in the Rhode Island economy. The Life Science Advisors is a new group that we've started to expand our board and to expand our network within the Rhode Island ecosystem. And we have invited all of these advisors to really help us grow the life science economy. So today, you're going to meet them. This is our inaugural launch of our Life Science Advisors group. Welcome, everybody. Good to see you all. And we're very excited to have them help us in all of our initiatives. So I'm going to turn it over to Patrice Milos, who is the chair of the Rhode Island Bio Board and the founder, CEO, and president of Medley Genomics.
So welcome. And I really want to start with Ed Bozzi, Professor Ed Bozzi, who has really been grounded in the Rhode Island life science ecosystem for many years. Ed is a professor at URI and leads the biotechnology program. And Ed's biotechnology program is now ranked 4th in the country for undergraduate students. And I think you can't start a discussion with life science advisors without starting and thinking about education. Because in order to have a vibrant life science ecosystem, you need talented, educated workforce. So Ed, I really want to start with you and just sort of get a sense of, what are your aspirations for these students as they finish URI's biotechnology program? And what do you hope for the Rhode Island ecosystem? You've been involved with Rhode Island Bio for a very long time. You have to take your mute off. And he really isn't Ann. He really is Ed Bozzi.
Okay, now you can hear me.
Yes, great.
Okay, sorry. So, yeah, actually this September, welcoming the 18th class into the University of Rhode Island for biotechnology. So we've had 17 prior classes. It's a 4-year program leading to a Bachelor of Science degree in biotechnology. And the major is quite a popular one now at the university. We're actually space limited at the moment. One of the attractions that students have for the program is an internship. And that's really what got me involved with the biotechnology industry in the state of Rhode Island, was the ability to help students to organize internships. And what we found over the years are that these internships are better organized at smaller bioscience companies rather than the Amgens and the Genzymes of the world. Because with the smaller companies, they get to know us. We have an excellent track record. And so it's much easier for us to position students at these smaller companies like Epivax, for example, or like Prothera Biologics, or like Veroscience. So that got me involved with all these companies to better, again, organize the internships. So what happens to graduates of this program when they leave the university with a Bachelor of Science degree? While they do their internships at these smaller companies, they typically don't get hired by the small. Some do, but it's certainly not the majority. The majority of students then end up working for a large biopharma companies. So for example, Amgen, I don't know how many of our students are at Amgen, but it's a large number that are there. Rubius Therapeutics has been going on a hiring spree these last 6 months to staff the facility in Smithfield, and so many of our students are there. I'm proud to say that we've got 6 students at Moderna working on the COVID-19 vaccine, so that's great news for us also. And where do students work when they get these positions at these large biopharma companies? It's all over. It's in the labs. It's in a process development lab, a quality control lab, an R&D lab as a lab technician. Some are in production and actually producing a product. So it really varies. Do any of them want to go to graduate school? Yeah, they do. One of the situations that we have now is that the university in the past used to offer a professional master's degree in biotechnology, and we don't any longer. And that's a shame, really. We have many of our students actually enrolling in this and getting master's degrees in biotechnology. Right now, the 2 closest universities that offer a master's degree in biotech are Worcester Poly and Northeastern. So we have students at both institutions now working towards a master's degree. Few of them are enrolled in PhD programs. So we do have some, but it's not that common. The student Robert that interned with Patrice is trying to enroll in a PhD program. But that's not the norm. The norm is working, and then while the student is employed by large biopharma companies, then enrolling in a master's program and getting the tuition paid for, and mostly by the company they're working for. So one last aspiration is that we think we do so well in educating these students in biotechnology that we get a lot of siblings in our program. So a brother or a sister graduates the university, does well, and then interests a low-age sibling to enroll also. So we have many of those kinds of situations. We have husband and wife kind of situations also. So
great, thank you, Ed.
I think that covers it.
Great, and I think the concept of education is so important. And I want to go to Jerry Herrmann next. Well, first of all, there's one secret about all these life science advisors. They all live in Rhode Island, and many of them don't work here. So our aspiration in general is that eventually they're leading companies here in Rhode Island, but it's a good foundation for us to start to help our entrepreneurs. But Jerry Herrmann, Jerry is currently co-founder and chief scientific officer at Hotspot Therapeutics, an Atlas-funded startup, although I don't think it's a startup anymore, Jerry, based in Cambridge, raised Series A, Series B, working on allosteric inhibitors or allosteric modulators for various therapeutic indications. And Jerry got her PhD at University of Rhode Island, and I just wanted her to talk a little bit about that and then also her experience because she has been in the venture community in Cambridge for a number of years, a number of different companies, and maybe just talk a little bit about that. And then I'm going to come back and ask her a little bit more. So Jerry, welcome and thank you for joining us.
Yeah, thank you. Yeah, hi everyone. Yeah, so you know, super happy to be involved in this group, and you know, bring some of my experience to the table. And as Patrice mentioned, you know, I got my PhD at the University of Rhode Island, and I think you know, when we think about education and how it prepares, you know, one for you know a career in the pharmaceutical sciences, I think it's all about you know, training the right science at the right time. So really thinking about, you know, what are, you know, what's, you know, where is kind of the capital funding going, and how that can be, how that can be impacted by, you know, how you prepare students for the next stage, you know, of their careers. You know, for someone like myself, you know, I went on to, you know, a number of Boston biotechs in my career, and really kind of culminating to, you know, starting my own company. And I think probably as one kind of reflects on, you know, education, and I think probably a bit more critical is the ability to network and to get to know the right people, and you know, position yourself for success. So I think you know, one of the things that I've noticed in, you know, Boston Biotech, and especially, you know, as being an Atlas portfolio company, is the number of companies now that are kind of moving out of the area of small molecules and moving into some other different types of technology. And I think being able to prepare students for all different types of, you know, aspects of biotech is key. And just thinking about my own kind of career path, you know, in my time when I graduated from URI, it was mostly like a small molecule type of emphasis in biotech. And, you know, that had kind of, you know, brought me to kind of using that expertise in bringing forward, you know, allosteric drug discovery. And I think, and I think one of the kind of unique aspects of my, you know, current company, just kind of circling back, Patrice, at your, you know, comment about how many of us here actually, you know, work in Boston. You know, I think it's you know, we're kind of at a very interesting inflection, you know, in our world of how companies operate. And when we think about the ability of, you know, taking virtual companies and, you know, putting them basically anywhere in the world and being able to garner talent around the world is really, really maybe an important time for us to capture in Rhode Island biotech, because, you know, someone like myself, you know, I couldn't get funding for, you know, or the size of funding I wanted for hotspot therapeutics without actually without being Cambridge-based biotech. But I think that, you know, having the ability to do so much work remotely may allow the Rhode Island biotech now to kind of reach out and, you know, start companies here, but yet reach out to, you know, a number of employees around the world. And I think this could be an opportunity for Rhode Island biotech.
I think that's a really important concept, Jerry, and I think we'll come back to that at the end. I think in many respects, Jerry is one of the reasons why we have this Life Science Advisors. And I want to tell you an example of what we aspire to for Rhode Island Bio in building the partnership with these individuals. So I remember the day that I met a gentleman by the name of Nick De Silva, who was finishing his PhD at the University of Rhode Island. And Jerry is always saying, I want to really help, you know, Rhode Island, URI. I feel like a graduate there and I want to help them. And Nick had the idea of starting a biotech company focused on allosteric inhibitors for PARP, which is a particular target that is relevant for breast cancer. And I said, okay, Nick, you have to meet Jerry Herrmann. And so they met and had a good discussion. We'll talk a little bit about that. But following that, then I introduced Jerry to Slater Technology Fund as Nick was beginning to look for funding. And without Jerry and that connection of someone who was really a world expert in allosteric inhibitors, I don't think Slater would have had the confidence to understand about what Nick was offering. And it was that full circle of a PhD graduate from URI, a really important therapeutic area, a world expert, and funding that really led to the launch of Alcinous. And so maybe, Jerry, just a minute or two on how that experience has been. And thank you so much for the contribution you've had already.
Yeah, thanks for that, Patrice. Yeah, I think, it's humbling to start a company, right? So you realize how much you need, right? And how many people you need to help you. And I think finding those people that are willing to help you in the absence of anything in exchange is probably one of the most critical things to start a company. In starting Hotspot Therapeutics, we went our first 6 months with folks from all over the world kind of pitching in and helping kind of build our technology platform, and really asked for nothing in exchange other than to be involved in something new, something exciting, and be able to build something with another team. And so when Patrice introduced me to Nick and his efforts in trying to build something around the PARP inhibitors, I felt that it was something that was kind of near and dear to my heart, because I just went through that, right? I just went through like asking people to help when I had nothing to give in return, and other than an opportunity to really help do some really cool, interesting science. And so so I met with Nick, and we talked about his science. I could see the promise in what he was trying to do. I could see all the green edges of what how as a young kind of entrepreneur, he was trying to kind of put all the pieces together. We talked a lot about finding the right people to huddle around you and kind of help the company grow, to get to that critical amount of data that then can secure some funding. And so we worked on trying to get that done with the help of doing his work at the URI campus, and then with the Slater technology group, and really kind of working together with them to kind of map out what does the next 6 months look like, what does success look like, how what are the experts that we're bringing to bear on the problem, because with a company in that kind of seed funding stage, there's not a lot of extra cash to use to kind of build the science story. So it's all about kind of building the science story that can then lead to the next round of funding.
Great. And Jerry's been instrumental there. So thank you, Jerry. Another important aspect of life sciences is clearly intellectual property. And Scott Keeley, who is a patent agent with Keeley and D'Angelo, has already been a great partner for Rhode Island Bio's, done some workshops. And really, I just really wanted to give him an opportunity to just, reiterate how important life science entrepreneurship is, really understanding the importance of patents, the role it plays. Just to talk about that briefly, Scott.
Sure. Yeah, we always say we do well in an educated environment, and RIBio is certainly helping with that. So we've been giving talks over the past year, continuing. I do a brief talk about how to draft a provisional patent. And even if you're not ready to file that on your own, if you're ready to take that to a patent practitioner, can certainly reduce the cost of that initial patent process, just to have it ready for the patent attorney or patent agent. And we've also been giving talks because of the situation, because of COVID. A lot of our clients are less than fully employed. So we've even put together a program to help inventors with the US Patent Office pro bono system, which is an interesting process. And I know we're constantly teaching people how to not come to us for services. Counterintuitive is what it comes down to.
But
and,
I think, Scott, it reiterates your commitment to the entrepreneur, to the community, because we all benefit.
Right. Well, you know what we find is usually it gets them started and they realize, I need help with this. So then they know who to call.
Yes,
So
exactly.
Yeah.
Great. Great.
Well,
and I know you'll
continue
continue.
activity in the field. You know, we see some activity in cell sorting that continues to go on. And just a very exciting area. Flow design of Wilbraham, Mass. had some good success in the past year. And they're in fluid filtration, sonic wave filtration.
Nice.
Yeah.
Great. Okay, thank you, Scott. So our next advisor is John Thompson. John is the VP for Genomics and Computational Biology at Homology Medicine in Bedford, Mass. One of the secrets, again, here of this group is John and I met each other when I first moved to Rhode Island, and we were on the third floor of the J. Walter Wilson Laboratory at Brown University. It's no longer a laboratory, but the building is still there. And we've been colleagues. He hired me at Pfizer. I hired him at Pfizer. We've gone back and forth and followed each other's careers. John is doing amazing things, probably one of the smartest people I know. But what's fascinating from a perspective of John, and I want him to talk about it. So John left Brown and went to Pfizer in Groton, Connecticut, and really was an expert, an executive there, and then transitioned to the world of startups. And I would just love, John, for you to be able to share your experience there with people. And you know, some highlights of your career path and what you're doing now, which is so amazing in gene therapy. So John, off to you.
Hey, well, thanks, Patrice. It's kind of scary to think of how long ago it was we met. But got my calculator out and realized that I'm a native Rhode Islander, so I was born here and then came back after my PhD, and I have been back here now 38 years. Since then, and in that 38 years, I have worked in 4 different states, and only moved once within Rhode Island, from one part of Warwick to another part of Warwick. So there are lots of things you can do living here. Unfortunately, working here is more of a challenge. I was at Brown for 6 years, and I was at NAPSIS for 3 years, but all the rest of the time was elsewhere, Connecticut, Massachusetts, and Maryland. And all very different companies as well. I mean, so as Patrice mentioned, at Pfizer, but then also at a couple of diagnostics companies, a couple of different technology development companies, and now a gene therapy company. And I think it highlights, you know, how biotech changes over time, that things will never be the same. And I think now is, as people point out, a really unique time to reassess how you can establish a more thriving and growing biotech environment in Rhode Island, because with COVID, it is changing people's ideas about what it means to have a lab. We are struggling, like I said, I'm supposedly in Bedford, Mass at the moment, but I'm not. I'm physically in Rhode Island because I go up there twice a week and I'll work from home the other days, which is great in terms of saving on commute time, but it makes the science that much harder. And I think that we really need to think about how we're going to do the science, because you do need face-to-face interactions. You can't do everything remotely and do it as effectively. You know, science requires people talking about things, discussing things. And as we all know, Zoom calls are not the ideal way of discussing things. You can make presentations, but detailed discussions just don't work that way. So I think that, Rhode Island and others should be thinking, well, how can we make ourselves, a bigger part of the industry moving forward? And certainly, again, with Rhode Island being smaller with a more, with easier communication routes between government and academia and industry, we should be able to do things better so that, government provides support for academia that aids industry and vice versa. So I think there are lots of things that can be done to try and catalyze things. Now, it may not be in gene therapy, it may be in, as was talked about earlier with Epivax, immunology or other things, but you can't focus on everything. You have to pick an area and go with that, but make sure that what you're doing actually helps. It helps the startups so that when you have, a young entrepreneur who wants to start a new company, what can we provide that will help him do that? So having patent resources helps, having core equipment helps, having educated students helps. So I think all those things go together to really to help everyone. And as I'm not an expert on anything because I've bounced around all the time, but it's fun to do that. I learn lots of new things, and it can be frustrating at times. But again, I think that Rhode Island is a size that you can coordinate all these things and really, if we work at it, help to make a more thriving environment, because it's not like you'll ever be separate from the Boston environment. You'll always be part of that, and you want to take advantage of it. I think of one of the companies that Patrice and I worked at was Claritas, and we started out in Cambridgeport, or Mass, and that was like the slums of Cambridge, and the rent was low, and you had to be careful walking around. By the time we left, it was a high rent district. So that labs Claritas couldn't afford to stay there. Other companies were having to move out because the rent was too high for the lab space. It was no longer low income. It was now, they had coffee shops and all kinds of things that people who work in labs like. But I think that highlights that, Rhode Island is still relatively cheap compared to Boston, Cambridge. And, we should take advantage of that. There are things that can be done. Where you combine things. And I know a lot has been done already in terms of knowledge district, et cetera, and trying to combine things and, centralizing facilities so that you can work to the advantage of the companies in the surrounding areas.
Great. And John, I can't miss the opportunity to have you just mention a little bit about the gene therapy program that you're working on. Because it really is an amazing program and really represents the future of opportunity for healthcare. Yeah,
so one of the good and bad things about gene therapy is there's so many different ways you can do it. And we're going to find out which ones work well and which ones don't. So I'm at Homology Medicines, and what we're doing is using a viral vector called AAV to insert corrected genes into somatic cells. So it's not germline changes. So this is not intended for babies, but it's intended, if you are born with a genetic disease that is life-threatening or really life-impacting, we can try to fix that. And there are lots of different ways to do it. The one that we're focusing on now is PKU, which, people probably, is one of the more famous rare diseases, where all you have to do is treat with diet. The problem is that even if you treat with diet, people tend to have a very difficult life because it's very difficult to stay on that diet. And if you eat the wrong thing, then you have a big problem. But that same system can be expanded into lots of other diseases. And unfortunately, there are literally millions of other rare diseases that, you can't have a billion-dollar development program to fix them. So you have to have novel approaches and say, okay, we're going to have a vector that will help individuals overcome this disease and have it be much cheaper. And in fact, it goes all the way down to, N of 1 experiments. In fact, Patrice and I work with Dr. Tim Yu at Boston Children's Hospital, and he's in the process of developing a therapy that fixes the disease for just one person. So there's one little girl that needs a particular antisense oligonucleotide, and they're making that, and it seems to be helping her overcome her disease. And again, that's a very different type of approach than we're doing, because we're trying to integrate the fixed gene into the genome. He's trying to get the antisense oligonucleotide in so it alters splicing so that you get the right splicing for the RNA. And there are lots of other things. I mean, there's a lot of talk about CRISPR, which to me is a little overblown because I certainly wouldn't want CRISPR injected into me at the moment. But, you know, there are many, many other approaches, and there's lots of room for innovation there so that, you know, if Rhode Island were to try and focus on some of those things, you wouldn't have to try and, you know, come up with every other company or every other technology. You just focus on a small number. And with a hospital system that's easily accessible and be able to work with you, that could facilitate those kinds of studies because you know, lots of things that are needed to make that a success.
That's great. That's great, Sean. Thank you. Len Buckbinder is, again, a Cambridge executive, worked in several different biotech companies, started his career at Pfizer. Len's most recent company was focused on the microbiome. Again, a very interesting and emerging area of science. I welcome your thoughts, but I also want to carry on with a theme I think that's consistent too. And sort of a second area, Len, is you really built your career at Pfizer around cardiovascular and metabolic diseases. But yet you left Pfizer and you go to a microbiome company. So it's the kind of consistent theme that we talk about. I think it's the resilience of science and the passion for exploring totally uncharted new areas of exciting science. But maybe comment on both of those, Len, for us.
Sure. Well, I think, you know, John hit the nail on the head as far as my career goes too, which is kind of jack of all trades and maybe expert in nothing. I actually started my career at Bristol Myers in oncology, went to Pfizer and worked in inflammation and immunological diseases, and then spent a significant amount of time in metabolic diseases, as you know. And so, but, you know, in each one of these experiences, you learn new things. I started in target identification, leading labs, leading groups, and then leading large research organizations and compounds into the clinic. And so, you know, you learn an awful lot during that time. And one of the, I guess, most exciting roles that I had at Pfizer was actually in the search and evaluation area in metabolic diseases. So I had an opportunity to do a secondment, an internal sabbatical, essentially, in business development, search and evaluation. And so you really get to see and learn about what's the proper way to evaluate things. And so that might be important for some of the investors and for RIBio as well as, you know, how do you do good search and evaluation, good due diligence? What are the things you need to look for? And one of the interesting tasks was actually to do a strategic review of the microbiome. And so this was coming up toward the end of my career at Pfizer, and partnered with the other therapeutic leads. So I was representing the metabolic disease, mostly NASH, a little bit of fibrosis, working with the inflammation folks because NASH fibrosis is a big deal. So going to places like JP Morgan and Bio, and then all of the companies that came in to tell us about what they were developing. And so that evaluation part. But the microbiome, it was amazing how the technologies really propelled knowledge around the microbiome very quickly. It almost happened with a blink of an eye. And so it was great to kind of do that strategic review. It was clear that some areas had progressed in their knowledge base more than others. But if you open up any major journal today, you're going to find microbiome is involved in everything. And to some extent, it's kind of a duh. If we only knew what we didn't know, it makes perfect sense. And so the idea here is, how do we harness how microbiome is influencing health and disease? And it clearly is. I think it's pretty much indisputable across many different diseases, even things like Parkinson's, where there's an extremely strong component of that. And so I'll challenge Jerry maybe just a little bit about one thing she said. So microbiome is new, and some companies are targeting it in very different ways, through live therapeutics, through synthetic biology like Synlogics. And so I think, you know, maybe some of those are the easier, with the amount of knowledge that exists today, ways to think about manipulating the microbiome. The next tier, I think, is really around understanding what the microbiome is doing at the level of molecules and pathways, and seeing if we can actually bypass the need to administer live biotherapeutics because we understand more. And so that was kind of Kintai. So in full disclosure, Kintai and I parted ways recently, and I'll be starting next week in a new startup in precision oncology. So I'm moving on again. And
Great.
it's a small molecule therapeutic company. So people are still doing small molecule therapeutics.
Yeah.
But that's for another day. But whatever I'm saying today is not as a representative of Kintai, but I still have some knowledge in the microbiome area. And I think what the interesting approach there was trying to develop new data sets, so getting high quality patient samples. And in fact, we had collaborations with Brown, Howard Safran, and Benito Carnito. And, so some of those, I think I pronounced the name wrong. I'm sorry about that. Benny is his nickname. And we're getting high quality samples from Brown, which our samples were poop, but you have to preserve them in the right way. And so the idea here is, can we learn why somebody responds to checkpoint inhibitors rather than just at the bug level? What are the bugs doing to influence that? And I think we actually made some great progress in that area by combining all of the new technologies, building our own metabolomics and metagenomics, and then the synthetic chemistry, as well as, of course, very strong computational was needed to pull all of it.
I think, Glenn, what's fascinating to me about the microbiome is, everybody goes to the Whole Foods and buys their bottle of probiotics.
Yeah.
And who the hell knows what's really in those? And half the time they're dead.
Yeah.
But we're beginning, I think, we've got the data now to begin to explore, as you said, sort of what is the mechanism by which some of these bugs are doing things that are protective in different circumstances. Would you agree?
Absolutely. And don't get me wrong, live therapeutics have their place. Series and Vedanta have been progressing things in the IBD and C. diff areas, and they're looking very good. And so I think those things will become drugs. They have their own challenges in manufacturing and so forth. But if we can really understand those mechanisms, I think we'll get to potentially a better place. To your point, there's actually some data from immune checkpoint inhibitor studies where people who've been taking probiotics actually have worse outcomes. So it's just something to be careful of, that we don't know. The science doesn't necessarily back those up for all diseases, and maybe better for immune health or gut health, but maybe not better for oncology.
Great, thanks very much, Len.
Yep.
Our last new advisor is a gentleman by the name of Brian Morley, who is the founder of Emerge. And Brian is relatively new to Rhode Island, I think, as well. Emerge is really helping in the healthcare and consulting, marketing, business strategies, which is so valuable to we scientists who tend to focus on the science, but you got to raise money, you got to understand your market. So Brian, if you want to talk a little bit about your background and how you are beginning to help life science companies here in Rhode Island, would be great.
Sure. Well, thank you, Patrice. Appreciate the time and honored to be a part of this group. So I think what I provide to this ecosystem, and I'm actually sitting in it right now, I'm in the CIC, that's where I'm headquartered, and I'm looking at the ecosystem as we speak. So I think what I provide to this group is a different kind of muscle. And the muscle that I'm bringing, I think you just mentioned it, is really kind of providing a market strategy and commercial muscle. And when a lot of folks in the startup world hear marketing, they think digital marketing, they think social media, they think ad agencies, logos, websites. That's actually not what I do at all. That is a part of marketing. That's a component of, I would say, downstream marketing. But what I can help provide is kind of that front end strategic component. Really help work with an organization, whether it's a startup, pre-seed, seed A, or even an established institution, you can kind of bolt on my skill sets and my attributes to really help identify core competencies, value propositions, understanding what segment of the market we're going after within that segment, who we're targeting, how we're going to position the technology, and then how we're going to develop our go-to-market strategy and how we're going to execute that. And from what I've found thus far is, and similar to our panels here, right? From a technical and scientific perspective, we have strengths out the wazoo. But when it comes to that part of bringing that to the market, that's when folks either try to DIY it and kind of evolve that muscle. But once again, if that's not your core competency, your skill set, it's hard to build a muscle while you're also trying to drive everything else. So that's when they find that bringing in an industry partner like myself that has that can kind of take that component, build that competency, help identify those blind spots, help kind of identify what are the key elements that we need from a business perspective, and then help actually build that out. Right. So not only can I help the front end and understand what are the key elements from the strategy perspective that we need to build out to bring your business to the market, but then help actually close those gaps. So one of the other things that I have is I think Jerry mentioned it, the access to a network, and that's the great thing about this community is the strength of the network. And that story that you told is how you were able to kind of one or two dots and then made this whole thing happen. I think I bring a network too, and it's very different than everybody else's network. And hopefully it's additive to this community. And thus far in the 4 months I've been established, I've been able to pull in some folks from my network that are outside of I think probably everybody else's network, and bring in whether it's pricing strategy, whether it's go-to-market strategy, whether it's an evidence generation AI person from the West Coast, people that I know that can help these entrepreneurs or established firms in Rhode Island achieve their goals. So that's kind of what I've been able to bring to the table. And then within the details of kind of the market strategy, there's, market analytics, getting the stakeholders and customer insights and customer discovery, brand strategy. I can partner with a brand strategist, pricing strategy like I mentioned before, and kind of all the way to commercialization. So yeah, I've been here 8 years, did about 10 years with J&J in the marketing world, and then it did about a decade of R&D. I'm a mechanical engineer by trade, so I did about a decade of engineering. So I can kind of talk tech with tech, the science and the engineers. I worked very closely with surgeons for the last decade, so I kind of understand that world really well. But then I also can balance it out with the other part of me as well. So I think I can kind of speak both channels. So yeah, excited to be a part.
Thank you. So I just want to make sure anybody who's listening and that has any questions, don't hesitate to either raise your hand or put a question in the chat function, because we're happy to answer them. So the hope has been, hopefully you've seen today that while Rhode Island Bio is a Rhode Island organization really strengthening to help support the entrepreneur, the community, by leveraging our colleagues who live here in Rhode Island, but don't work in Rhode Island, and have a whole different network across a multitude of disciplines, disease areas. That's what we want to be able to continue to be able to tap into and, make available. I know when I came back to Rhode Island 4 years ago, I had no idea what was happening in Rhode Island. And I would view these people as people who in the future, as they finish their, stellar IPOs and things like that, want to come back. They still live in Rhode Island. Jerry lives in Charlestown, Len in East Greenwich, John in Warwick. Scott, I don't know where you live. Where do you live?
I'm in Charlestown, Rhode Island at the moment. We do
Great.
spend some time in
Okay,
Philadelphia.
We like to call that God's country.
That's right. Where God lost his shoe, actually.
This is a funny comment and it's off, but it's typical Rhode Island. So I was talking with an esteemed gentleman the other day, I said, "Oh, you're in Narragansett." He said, "I don't live in Narragansett. I live in Charlestown." And it was just so funny to hear somebody, because Narragansett, John has a little summer house. It's just beautiful. But for him to like, "I live in Charlestown."
We're a whole that's a whole 5 minutes away, don't you?
I know, it's a funny, funny world. But I want you all to also be able to have a window into Rhode Island. So as you have ideas, as we need CEOs, and I know Brown University has several startups that they want to launch, and they need CEOs. We want to be able to tap into your expert network of really people who are really at the top of their careers. I did want to ask a little bit about whether, and Jerry mentioned this a little bit, whether the pandemic is really reshaping how we can think about Rhode Island in the life sciences. And I'll just mention that I am starting a new job at the end of the month at a startup that is based out of MIT, that's focused on COVID-19 diagnostics. And I never have to leave my home here in Edgewood, Rhode Island. And there was no doubt in anybody's mind that it didn't matter where you lived as long as you could do the job. Now it's a little different. I think John is right. We have a lab group at Lab Central in Cambridge. If we had our own incubator here, we might move them here. But anyway, I would just love to hear your thoughts about how you see the pandemic reshaping what we as Rhode Island Bio might be thinking about and doing. And Carolyn, I would really benefit from your thoughts.
You know, Patrice, I think, you know, providing a good home for the startups, you know, especially, you know, for those companies that can run mostly virtual.
Yes.
You know, Incubator Lab Space. I know a number of years ago, URI was talking about, you know, having incubator space on their campus, but I really don't know what happened with that. But
it's still on their list, but it hasn't happened really for. I mean, they've been very supportive for URI-based startups, and a company called MindImmune, which many people know, is based at URI. They're also faculty. So, but they're so limited in what they can do. Yeah. But you're right, Jerry. Other thoughts?
Yeah, I mean, I agree with Jerry with, you know, if you build it, they will come, right?
Yeah.
And it's not just the startups, but it's the sponsorship from the large organizations. And I know those things are underway, and there's some great wins that have happened over the last couple of years. And we just have to keep the gas on, and we should leverage this group to try to help, you know, broach subjects with, you know, our previous companies and things like that. Like that's what we need to do. We need to kind of put ourselves out there and engage these larger sponsors, and then also, you know, always pick our head up and look around and say, you know, what other opportunities are out there that we can maybe do a partnership with either outside the US or something like that eventually gets us to where we need to get to. So, you know, coming up with creative solutions on possible alternate segments. And
great, Brian.
My thoughts.
Yep. Len or John or Scott. I mean, it is a funny story because 5 of us in this group took the train every day to Boston. Right. Scott, Jerry, John, then Len joined us too. Would ride to Boston on the train, go to Cambridge, come back to Rhode Island. And there's a reason why we did that. I mean, we really love living here. It's a great place to live. Now we need to continue to build the life sciences. And there's a lot of momentum. I think just last week's announcement about the merger of Lifespan, Care New England, Brown Medical Center is a huge step forward, because faculty that were at the hospital and were researchers, there was so much uncertainty. It's going to create a whole new energy for IP, so, you know, centralized innovation that is there, that is just locked in those places because of the politics. So we can only hope that that just uplifts everyone, and I think it will. Others? John?
Yeah, I think, you know, the transportation aspect is a key. I mean, because people are going to be looking at it differently. Would you want to take that same train now to Cambridge? And the answer, of course, is no, because it was packed. So it would be a challenge in the current, you know, for the next year or more to do that kind of thing. But you still want to have, you know, be part of the mass transit system. So even, I mean, the advantage of being in Rhode Island, if you have a workplace here, is that you're actually on the low traffic end of the trains. So that, you know, there were people that took the train from Boston to Providence every day, and they had much more space than the people going the other direction. So that's an advantage. We want to make sure we don't lose plane contact. I mean, from the last 2 years I worked in Baltimore, I could do that because there were really good connections to Baltimore by plane. Those are disappearing rapidly. I mean, you can't get the same flights you used to be able to get. And there's no telling, you know, long term, how many flights will be leaving Providence versus the way it used to be. So, I mean, those are the kinds of things that if you're going to have remote locations, you also need remote transportation. Now, a place like Boston doesn't have to worry about that. They will always be on the main line, but, you know, Providence, Rhode Island need to work to make sure that the needs are met. So that they're on the, you know, there are enough trains and planes. There's certainly no problems with automobiles getting here, but with other aspects, you know, it's always an issue.
Certainly there has to be the brick and mortar from which we work remotely from. Even when I was commuting to Boston, I was working remotely 2 to 3 days a week. And so what you're saying, Patrice, about there needing to be a physical presence is important as well. We have the best place to work remotely from, but there has to be that a little bit of that substance to be remote from.
Yeah, and to build on that, I would say, you know, it really comes down to, you know, the how do we facilitate it? If you had a lab central in Providence, you could maybe start to think about people all of a sudden generating their ideas from Brown and URI.
We've been working.
You know, we can start.
That's a key initiative that Rhode Island Bio is pushing constantly with commerce. Toonie's mentioning District Hall Providence, which is a great location to facilitate meetings and space, and that's just been in existence a little bit over a year, and 4 months, 5 months in, it had to shut down. I mean, it's been interesting, but you're right, Len.
Yeah, it's going to be difficult to think how that starts now, you know, in the middle of the pandemic. But, you know, there are some interesting kind of blended models that may be possible. You know, I know one of my good friends is, you know, represents, you know, Chem Partner. And, you know, they've built a kind of incubation lab space in Cambridge where they, you know, incubate science. But they also have some skin in the game, right? So they're giving a little bit of funding, but it's in-kind funding, right?
Yep.
And if we could lure or attract, you know, maybe one of these kind of a fee-for-service or, you know, investment arm of a CRO to participate, you know, maybe they would be interested in, you know, putting some investment in some space in Providence.
Yes, I'm mindful of time, and we have 2 minutes remaining. I guess I have one last question. How can we as Rhode Island Bio help you as life science advisors help us?
For me, you know, keep communicating what I think like the macro challenges are, so that we can continue to think that way. Because, you know, when I'm running my business, I'm thinking about my business, but keep plugging me into the next level up and the next level up, so that I can help drive those initiatives when appropriate. And then, you know, selfishly, it's you know, for the team here, if you come across folks that need that, my skill, my expertise, or that muscle, connect me, and I'll do the same. Once I learn more about what everybody does, then it's easier for me to make those connections. So that's going to help raise all tides.
Great. And you know, email now, we will, I mean, Carol and I always talk, it's about communication, both outwards and inwards, and we'll make sure we do a good job. I promised all of you I wouldn't take a lot of your time. So I can't thank you enough for your time today. You are world experts, and just having that ability to tap into for our colleagues here in Rhode Island, like Jerry has done, can make a world of difference for our community. So we will find you, we will be kind on your time, but thank you for your time today and all you're doing to help us here in Rhode Island. And